Hello, my name is Gemma and today I'll be delivering a presentation on health promotion. During this presentation, I aim to explain health promotion, identify 2 health campaigns, and explain how they relate to society and the individual. Furthermore, I will outline my health promotion activity and explain its rationale in relation to health promotion theory. Finally, I will discuss how to determine the effectiveness of the resource developed for my health promotion activity. So, what is health promotion? Health promotion is an area of health that raises awareness of issues and educates people on how to be healthy. It is believed that many injuries and diseases can be prevented if people make healthier lifestyle choices and are advised on how to reduce risks to their health. Of course, being healthy can mean different things to different people, with health promotion aims and strategies differing in England, Wales, Scotland, and Northern Ireland. Health promotion benefits the individual and the nation through the delivery of information and education, which in turn aims to empower them to make positive lifestyle and well-being choices for themselves. The primary areas where health promotion are often focused include well-being and mental health, diet, obesity and physical exercise, smoking, alcohol and drugs, and HIV and sexual health. Health promotion activities and campaigns are often an important part of many health and social care roles, including general practitioner nurses, school nurses, midwives, and health visitors. The overall impact of health promotion campaigns on society aims to reduce the level of illness and disease, reduce the levels of crime, increase the uptake of vaccination screening programs, address high-profile health and well-being concerns, and reduce the financial cost to the NHS and government. In 2009, Public Health England launched a campaign, Act Fast, aiming to save lives by educating individuals and the nation on how to spot the signs of a stroke. They used the easy-to-remember acronym FAST, so F-A-S-T, to explain the symptoms observed in the face, arms and speech of someone having a stroke, and reminds them that it is then time to call 999 fast if any of these symptoms present. Awareness was spread through TV adverts depicting a scenario of an individual suffering the symptoms, as aforementioned, and being spotted by another person who is then able to call 999. Alongside the TV adverts, health services such as GP practices and hospitals began displaying posters and leaflets with an aim to spread their message and raised awareness specifically to the Black and minority ethnic communities through multicultural radio stations. This target audience was due to research showing that people of African and South Asian origins are twice as likely to suffer a stroke in comparison to people of European origins. Professor Kevin Fenton, who is the National Director of Health and Wellbeing at Public Health England, said this Act Fast campaign can help save lives. Stroke is a treatable condition and continues to be the 3rd leading cause of death in England and the largest cause of adult disability. The campaign was successful at reaching a large audience and educating people on how to spot the signs of a stroke and what they should do. Many primary care professionals, stroke patients and stroke witnesses had a positive view of the campaign, but sadly, despite this, the perceived impact on individual response to a stroke was still low. Change for Life is a health promotion campaign that was launched in 2009 by Public Health England. Initially as a health initiative aimed to reduce the rising levels of the proportion of childhood obesity by educating and encouraging parents of children aged 5 to 11 years on healthy lifestyles. They used the slogan, "More kids, less food, eat less, move more, live longer," to emphasise their rationale, which is essentially to make healthier choices to lead healthier lifestyles. The purpose of the campaign was split into 4 stages: to alert families by educating them on the dangers of excessive sugar consumption, to motivate parents to take control of their children's diet, to support them with ongoing change through free assistance, and to sustain these changes in order to ensure their children are consuming less sugar in their diets. To do this, Change for Life utilised many areas of advertisement through mass media, targeted advertising, social media, school engagement, apps, and local GP surgeries. They also used branding that was attractive to all ages of the family and created a platform that was very user-friendly. The Change for Life campaign exceeded all of its first-year targets as it reached 99% of its target families, with 413,466 families joining within the first 12 months. This led to the expansion of awareness of the campaign, with local and commercial partners significantly increasing their support. As of 2010, Change for Life has branched out with a campaign called Start for Life, which aimed to target the education of parents of young infants regarding a healthy diet. The health promotion campaign that I have created is called Say No to Nicotine. This campaign is targeted towards individuals who are already using nicotine products such as cigarettes and vapes, and those who are considering starting. This campaign aims to bring education and awareness to individuals and nations regarding the negative physical and mental health implications of both short and long-term exposure to nicotine products, in the hopes of preventing as many people as possible from partaking in this habit. At the forefront of this campaign will be slogans that are easy to remember, such as "Vaping is a shortcut to chronic illness" and "Choose freedom from smoking, choose life." This is to emphasise the importance of the message that is being conveyed. The rationale behind the health campaign Say No to Nicotine stems from the increasingly worrying levels of young people deciding to use nicotine-containing products, most commonly now in the form of e-cigarettes. And this is without completely understanding the detrimental effects it has on both physical and mental health. A survey taken by NHS Digital suggests that e-cigarettes use in secondary school children is rising, with 1 in 5 15-year-olds using e-cigarettes in 2021. This survey also suggested that 57% of the children purchased the e-cigarettes from a local shop, despite it being illegal to sell to anyone under 18 years of age. With e-cigarettes being relatively new to the market and sold as an aid to quit smoking tobacco cigarettes, their long-term health effects are still not fully known, but side effects have been recorded, such as nausea, vomiting, lung conditions, memory and cognitive impairment, oral disease, and increased susceptibility to respiratory infection, which is causing an increased concern to child health experts. There is a long list of health implications linked to smoking, including COPD and other lung diseases, lung, throat and mouth cancer, stroke, hypertension, gastrointestinal illness, cognitive impairment, including an increased risk of developing dementia and a higher risk of developing a mental health condition. This is why I believe a campaign aimed at prevention and support to the nation to educate and raise awareness of these issues can greatly impact the next generation. In 2022, New Zealand became the first country to pass a law banning the sale of cigarettes to anyone born on or after the 1st of January 2009, and this was to push the country to be smoke-free by 2025. Preventing the younger generation from access to cigarettes will greatly improve the outcome of their health by avoiding the addiction altogether, causing less of a strain on the cost of treatment of long-term health conditions to the NHS, and I believe this is something that should be encouraged worldwide. The stages of change model, also known as the trans-theoretical model, and describe the process by which people overcome addiction through small steps, ultimately leading to a change in behaviour. The stages in relation to smoking are pre-contemplation, where there are no plans to quit and health advice is often dismissed, as the individual may be in denial or ignorant to any damage being caused. The next stage is contemplation. This is where there's a desire for change and sometimes a plan, often due to an event, for instance new statistics being reported of an increase in lung cancer in relation to smoking. The preparation stage then depicts a desire for change and preliminary actions being taken, such as recognising the need for behavioural change and getting information from a healthcare expert. During the action stage, the individual has the ability to alter their behaviour and has a strategy in place to do so. For example, they may reduce their daily cigarette intake from 20 to 15 and may then reduce it even further. The maintenance stage is oftentimes harder than the first few steps, this is due to the need to avoid temptation and maintain their new healthy behaviour. Finally, the relapse stage is recognised as a definite step in the stages of change model. People are susceptible to temptation and relapses can occur, but it does not have to be continued. For example, an individual smoking a few cigarettes on a night out does not ruin all of their hard work they have put in. They just need to return to the contemplation or action stage and proceed from there. I intend to promote Say No to Nicotine by using a mass media approach through social media, TV, adverts, and pop-up ads. Promotion will also be run through posters and individual leaflets provided in secondary schools, colleges, universities, GP surgeries, hospitals, and community centres across the country to reach the entirety of our target audience. As the main focus of this health promotion is prevention, assemblies will be targeted at secondary school children aged 12 to 16 during school time to educate young people on the very real dangers of addiction to nicotine and to equip them with the social and emotional skills to not be persuaded by peer pressure. Alongside these promotions, there will be a website that can be accessed by all to offer support and advice with signposting links for various services, such as counselling, advice on quitting, and health advice, for example. For those who are navigating through quitting nicotine products, an option to sign up for free to track their progress is also available, which allows them to enter a date of when they last smoked or used an e-cigarette and keeps track of how long it has been and how much money they have saved. They can also see how their health is improving over time, and they can log how they are feeling each day and also interact with other members to offer support to one another. The website will be easy to navigate, user-friendly, with a variety of language options, including adjustments for those with a hearing or sight impairment. The platform will be available to download via an app on the phone, so people can access the help they need wherever, whenever. There will also be call lines available to speak to someone regarding any question or advice they need about nicotine, including advice for parents of young teenagers who are at risk of smoking or using an e-cigarette. The website and app details, along with the contact number, will be available on all posters and leaflets. To be able to achieve this, I will need to gather resources in the form of specialists, such as respiratory, cardiac and oncology doctors, nurses, including mental health nurses, website design experts, app design experts, actors and TV directors for the TV advert, and educators to design and implement the assembly for children. For the time frame, I would expect the planning and production of Say No to Nicotine to take around 2 years in total and will run for a duration of at least 3 years, with annual analysis to determine how effective the campaign has been and where improvements may need to be made. The website, app and call line will continue to run permanently for people to access support. So, to determine the effectiveness of the resource developed for the Say No to Nicotine campaign, it would be essential to run a thorough evaluation. I would plan for this evaluation to be done every 12 months through online and postal surveys in order to determine whether the target audience has been reached and whether this campaign has been effective at preventing and reducing the level of young teenagers and adults from using nicotine products. Gaining feedback is vital in understanding how the campaign has been received and what areas need changing to suit the needs of all individuals. Emails and text messages will also be sent out to those who have signed up to the website and app. The disadvantages of this campaign could be that people are not wanting to or ready to change their behaviour and improve their health. Also, without full support of all resources involved, including schools, NHS services and parental influence, the campaign will fail to reach the younger generation, and without support to those individuals that are susceptible to peer pressure, will not be able to prevent the uptake of nicotine use. Since the COVID-19 pandemic, I believe that people now are looking to make healthier choices in their behaviour, and with this, promotion will be more inclined to take the step towards saying no to nicotine. The evaluation would need to be written up and ready prior to the launch of the promotion. The evaluation could then be referred back to after the launch and completion of the campaign. the evaluation techniques, which could then be used to determine the effectiveness of the health promotion campaign, could be to focus on the evaluation design, the process of the evaluation, the impact outcome evaluation, and also choosing the appropriate method for data collection. So to summarise in this presentation, we have covered an explanation of the health promotion, identifying 2 health promotion campaigns, an explanation of how the health promotion campaigns relate to society and the individual, an outline of the proposed health promotion activity, an explanation of the proposed health promotion activity rationale in relation to health promotion theory, and a discussion on the determination of the effectiveness of the resource developed for the health promotion activity. Thank you.